Hi, my name's Ted O'Connell, and I'm the author of USMLE Step 2 Secrets. This is part 1 of the Endocrinology chapter. Before we get started, we'd encourage you to look at medicalschoolvideos.com for additional videos, and email us at step2secrets@gmail.com if you have any thoughts or ideas about our projects. Let's get started. What are the common symptoms and signs of hyperthyroidism? Symptoms include nervousness, anxiety, irritability, insomnia, heat intolerance, sweating, palpitations, tremors, weight loss with increased appetite, fatigue, weakness, emotional lability, and diarrhea. Signs include an enlarged thyroid gland, warm skin, a thyroid stare, which includes lid lag, exophthalmos, proptosis, and ophthalmoplegia, which is seen in Graves' disease. Additional signs include pretibial myxedema, seen in Graves' disease, tremor, tachycardia, and atrial fibrillation. Check a thyroid stimulating hormone, or TSH, when patients come to the hospital with new onset atrial fibrillation. What are the most common causes of hyperthyroidism? The most common cause is Graves' disease, which is characterized by a diffusely enlarged thyroid gland, positive thyroid-stimulating immunoglobulins and antibodies, exophthalmos, proptosis, ophthalmoplegia, and pretibial myxedema. In older patients, look for a toxic multinodular goiter, individual lumps instead of diffuse enlargement of the gland, and hot nodules on a thyroid nuclear scan. Other causes include an adenoma, a single lump that is hot on a nuclear scan, subacute thyroiditis, which is a viral infection with a tender, painful thyroid gland, and factitious hyperthyroidism, in which the patient takes thyroid hormone that is not indicated. Rare exotic causes of hyperthyroidism include amiodarone, which can cause hypothyroidism or hyperthyroidism. Other rare causes include a TSH producing pituitary tumor, thyroid carcinoma, and struma ovarii, an ovarian teratoma that secretes thyroid hormone. Describe the classic laboratory pattern of hyperthyroidism. The TSH level is low unless the patient has a TSH secreting tumor, while the T3 and T4 levels are increased. How is hyperthyroidism treated? Short-term stabilizing treatment includes propylthiouracil, or PTU, and methimazole carbimazole, which can be used as suppressive agents. Beta blockers are used in the setting of thyroid storm, which is a severe hyperthyroid state and a clinical emergency. Iodine can also suppress the thyroid gland, but is rarely used for this purpose clinically. Definitive curative treatment includes radioactive iodine ablation of the thyroid gland, which is the typical treatment. Surgery is preferred in pregnant patients so as to avoid radiation exposure. Hypothyroidism may result from either treatment, and if so, it is treated with thyroid hormone replacement for life. What are the symptoms and signs of hypothyroidism? Symptoms include weakness, lethargy, fatigue, cold intolerance, weight gain with anorexia, constipation, hair loss, hoarseness, menstrual irregularity, and menorrhagia is classic, myalgias and arthralgias, memory impairment, and dementia. Always rule out hypothyroidism as a cause of dementia. Signs include bradycardia, dry, coarse, cold, and pale skin, periorbital and peripheral edema, coarse, thin hair, a thick tongue, slow speech, decreased reflexes, hypertension, carpal tunnel syndrome and paresthesias, vitiligo, pernicious anemia, and diabetes. Remember the autoimmune association between these three conditions and Hashimoto disease. And then finally, coma, which is present in severe hypothyroidism. In children, congenital hypothyroidism may occur, which results in mental, motor, and growth retardation. What are the common causes of hypothyroidism? The most common cause is Hashimoto thyroiditis. Women of reproductive age are affected 8 times more often than men. Histology reveals lymphocytes in the thyroid gland, as well as antithyroid and antimicrosomal antibodies. Other autoimmune diseases may coexist. The associated goiter is non-tender. The second most common cause is iatrogenic after treatment of hyperthyroidism. Other less common causes include iodine deficiency, amiodarone, lithium, and secondary hypothyroidism because of pituitary or hypothalamic failure, in which case look for a decreased TSH. This may be seen in conditions such as Sheehan syndrome, which is hypopituitarism caused by pituitary necrosis from blood loss and hypovolemic shock during or after childbirth. Describe the laboratory findings in hypothyroidism. Elevated TSH, unless it's caused by secondary causes, as well as a decreased T3 and T4. Antithyroid and antimicrosomal antibodies will be present if it's caused by Hashimoto thyroiditis. Hyperlipidemia and anemia may also be present, and the anemia may result from chronic disease or coexisting pernicious anemia. Why is the free T4 or the free T4 index better than the total T4 for measuring thyroid hormone activity? Free T4 or the free T4 index measures the active form of thyroid hormone. Many conditions cause a change in the amount of thyroid binding globulin, thus changing total T4 levels in the absence of hypothyroidism or hyperthyroidism. Common examples include pregnancy, estrogen therapy, and oral contraceptive pills, all of which increase thyroid binding globulin. Nephrotic syndrome, cirrhosis, and corticosteroid treatment all decrease the thyroid binding globulin. T3 resin uptake is an older test that is unlikely to appear on the Step 2 exam, but if you are asked, it should rise or fall in the same way as free T4. How is hypothyroidism treated? Hypothyroidism is treated with thyroxine or T4. T3 should not be used. In older patients, it is important to start low and go slow because overtreatment can be dangerous. What is sick euthyroid syndrome? Any patient with any illness may have temporary derangements in thyroid function tests that resemble hypothyroidism. TSH ranges from normal to mildly elevated, and serum T4 ranges from normal to mildly decreased. Clinical circumstances and physical findings are the best guides to whether the patient has true hypothyroidism. In patients with sick euthyroid syndrome, simply treat the underlying illness. If the diagnosis is in doubt, repeat the thyroid tests after the patient recovers, or give an empirical dose of levothyroxine if the patient does not respond to treatment of the underlying illness. What are the symptoms and signs of Cushing syndrome? Symptoms include weight gain, changes in appearance, easy bruising, acne, hirsutism, emotional lability, depression, psychosis, weakness, menstrual changes, sexual dysfunction, insomnia, and memory loss. Signs include a buffalo hump, truncal and central obesity with wasting of the extremities, a round plethoric facies, purplish skin striae, acne, hirsutism, weakness, especially of the proximal muscles, hypertension, depression, psychosis, peripheral edema, poor wound healing, glucose intolerance or diabetes, osteoporosis, and hypokalemic metabolic alkalosis because of mineralocorticoid effects of certain corticosteroids, Growth may be stunted in children. What causes Cushing syndrome? The most common cause is iatrogenic because steroids are prescribed for many different disorders. The second most common cause is Cushing disease, which is a pituitary adenoma that secretes adrenocorticotropic hormone, or ACTH, which causes roughly 60% of non-iatrogenic cases. Women of reproductive age are affected 5 times more often than men. Other causes include ectopic ACTH production, classically by small cell lung cancer, and adrenal adenomas or carcinomas. How is Cushing syndrome diagnosed? The first test is either a 24-hour measurement of free cortisol in the urine. The free cortisol levels are abnormally elevated in this case. Or the other test is a dexamethasone suppression test, in which cortisol levels are not appropriately suppressed several hours after administration of dexamethasone if Cushing syndrome is present. A random cortisol level is an inappropriate test because of wide interpatient and intra-patient variations. ACTH is elevated in Cushing disease but decreased with an adrenal adenoma. If the ACTH is increased, an MRI scan of the brain should be obtained to look for a pituitary adenoma. If the ACTH is decreased and the patient has no history of taking steroids, an abdominal CT or MRI scan should be obtained to look for an adrenal tumor. Primary cancer is usually obvious when ectopic ACTH is the cause, and there may be symptoms such as weight loss, hemoptysis with a lung mass on chest radiograph in patients with small cell lung cancer. Treatment is based on the cause and usually involves surgery. What are the symptoms and signs of Addison disease or hypoadrenalism? Symptoms include anorexia, weight loss, weakness, and apathy. Signs include hypotension, hyperkalemia, hyponatremia, hyperpigmentation, but only if the pituitary is functioning because of melanocyte-stimulating hormone. Other signs include nausea and vomiting, diarrhea, abdominal pain, mild fever, hypoglycemia, acidosis, eosinophilia, and shock. What is the most common type of hypoadrenalism? The most common type is secondary or iatrogenic hypoadrenalism because of steroid treatment. Patients who are removed from long-term steroid therapy may be unable to secrete an appropriate amount of corticosteroid in response to stress for up to 1 year following cessation of steroid therapy. Watch for the classic postoperative patient who crashes with hypotension, shock, and hyperkalemia shortly after surgery and who has a history of a disease requiring steroid therapy within the past year. You may assess the ACTH, which is usually high, and cortisol levels, which are inappropriately low, to help make the diagnosis. However, do not wait for the results to give steroids, because the patient may die. Give prophylactic stress doses of corticosteroids in the setting of an illness, operation, or other stressor to prevent an adrenal crisis. What are the other causes of hypoadrenalism? The most common primary or non-iatrogenic cause is autoimmune or idiopathic disease. Patients may have other autoimmune diseases such as hypothyroidism, pernicious anemia, vitiligo, diabetes, or hypoparathyroidism. Other causes include metastatic cancer, especially lung cancer, infections such as tuberculosis, fungal infections, and opportunistic infections in AIDS and other immunosuppressed states, as well as the possibility of ketoconazole and pituitary or hypothalamic failure. How is hypoadrenalism diagnosed? This is diagnosed with an ACTH stimulation test. The plasma cortisol level is measured, ACTH is administered, and cortisol is measured again in 1 hour. The cortisol level should rise appropriately, usually to 18 micrograms per deciliter, or a doubling of the baseline, depending on the baseline value. An inappropriate response to ACTH indicates hypoadrenalism. Do not withhold treatment to make a diagnosis if the patient is crashing. That's the end of part 1 of the endocrinology chapter. Please join us for part 2 of the endocrinology chapter as well as our other videos.